cholesterol. Cholesterol is an indicator. So say I think, not even I think, there's all kinds of evidence to suggest that cholesterol levels of, 240 and, 230, anyway, 220, 240, 250 are perfectly normal, have always been perfectly normal. But if for some reason cholesterol levels appear to be on the higher end, they're going up or whatever, to me, it's like the light going on your dashboard, as you're driving down the road. That's telling you there's something going on. Now, you're not going to fix the problem by just unscrewing the light on your dashboard, and considering, to fix the problem, I unscrewed the light bulb and I don't have a dashboard light. At that point, it's incumbent upon you, if you really want to know what's going on, to pull over to the side of the road and lift up the hood and figure it out.
Mm-hmm.
What it's telling you is that there's something going on in your body for which extra cholesterol seems to be needed. Lots of reasons why cholesterol will elevate. Cholesterol is an acute phase reactant. It will elevate and sometimes plummet in response to inflammation in the body, depending on whether it's chronic or not. If it's chronic, it may plummet. Infections. If you have depressed thyroid function, I guarantee you're going to have elevated cholesterol. It just comes with the territory. Be happy cholesterol is there doing its job. But then you have to lift up the hood and dig a little deeper to figure out what you might need to do to correct whatever the underlying imbalance might happen to be that is causing your body to use cholesterol, protectively, right? So cholesterol, again, be happy it's there. That's not the problem. You have to figure out what else might be going on. And
what about triglycerides?
Well, triglycerides, again, so as with many things, it depends. But we know that triglycerides are a much more reliable marker of cardiovascular disease, elevated triglycerides. Anything over 100, it's like, you don't want to see it. Fasting triglyceride levels that way. And triglycerides, which are blood fats, are not the result of dietary fat. Dietary fat is actually absorbed mainly through the lymphatic system. There are certain short and medium chain fats like butyric acid and also medium chain triglycerides from things like coconut oil and whatever that are absorbed directly into the hepatic, bloodstream and immediately used for energy, either through beta oxidation or through the production of ketones, which are energy units of fat that your brain can use almost exclusively for its more optimal function. It's crazy how well your brain works on ketones, much better than the way it works on glucose. But other forms of fat are actually absorbed through the lymphatic system that way and not dumped right into the bloodstream. What happens when we consume carbohydrates in excess of what we need right now for an emergency situation where we're trying to outrun a cantankerous woolly mammoth or saber-toothed tiger, is it goes into your liver and it is then converted into triglycerides, into blood fats, where which are then transported around the body and deposited mostly in places where you'd rather not have them. And that's the kind of that's what's responsible for making the kind of body fat that most of us would rather not have too much of.
The adipose type fat around the stomach and things like that.